So the language is the index of intellect, and the organ of the phonation is the larynx. The larynx, we have seen up to now, is lying anterior to C3, C4, C5 and C6 cervical vertebrae and made up of 3 unpaired and 4 paired cartilages. The unpaired cartilages are epiglottis, also known as epiglottic cartilage. It is leaf-like. The thyroid cartilage, it is shield-like. The cricoid cartilage, it is signate ring-like. The arytenoid, the cuneiform, corniculate and tritiate, these all are paired cartilages. The epiglottis, the apex and part of vocal process of arytenoid, cuneiform, corniculate and tritiate, all are made up of elastic fibrocartilage, while the thyroid cartilage, the cricoid cartilage and base of arytenoid cartilage are made up of the hyaline cartilage. With the time, the hyaline cartilage undergoes the calcification, the mortal calcification, and the epiglottis, which is made up of the elastic fibrocartilage, having very little or almost no tendency to undergo calcification. So now we will see the anatomy of the epiglottic cartilage or epiglottis. So the epiglottic is leaf-like and it is unpaired, made up of the elastic fibrocartilage. So this is the shape of the epiglottis. Upper end is broad. Epiglottic cartilage or epiglottis is above the glottis. So in this model we will see the epiglottic cartilage or the epiglottis. The epiglottis is having upper and lower ends. So the upper end and the lower end of the epiglottis so this is the upper end, this is the lower end of the epiglottis. Two ends, upper end is broad while lower end is narrow. The lower end is, this is the lower end and this is known as petiolus. So the upper end and the lower end. Upper end is broad while lower end is narrow, and this lower end is known as petiolus. Two surfaces, the anterior surface and the posterior surface, and this is projecting obliquely behind the base of the tongue and the hyoid bone. Two borders, the right border and the left border. So upper end, lower end, right border, left border, anterior surface and the posterior surface. Projecting behind the base of the tongue, upper part, and hyoid bone, the lower part. The upper end is covered by the mucosa. The mucosa of the upper end is the stratified squamous, non-keratinized, stratified squamous, non-keratinized. This is the same mucosa of the pharynx, and it is forming the upper border of the laryngeal inlet. It is forming the upper border of the laryngeal inlet. The anterior surface, the upper part of anterior surface is also covered by stratified squamous, non-keratinized epithelium and the mucosa, reflecting on the tongue. So this is the epiglottis in lateral view, the thyroid cartilage, the hyoid bone and the tongue. The mucosa is reflecting from the epiglottis to the posterior surface of the tongue and the lateral wall of the pharynx. So this is the lateral wall of the pharynx and reflecting from the epiglottis to the lateral wall of the pharynx and posterior surface of the tongue, forming one median and two lateral glossoepiglottic folds. Glossoepiglottic folds. The two depressions on two sides of the median glossoepiglottic fold are known as vallicula. So reflecting behind the tongue, and these two depressions are known as the vallicula. So superior part of anterior surface of the epiglottis is covered by mucosa, which is having stratified squamous non-keratinized epithelium and reflecting on the posterior surface of the tongue as median glossoepiglottic fold and the lateral part of the pharynx, forming the lateral glossoepiglottic fold. Simply the area between the median and lateral is forming a depression known as vallicula. The inferior part of the anterior surface is in relation to the hyoid bone and this is the hyoid bone and the thyrohyoid membrane. So inferior part or surface is in relation to the hyoid bone and thyrohyoid membrane. Thyrohyoid membrane. This is the hyoepiglottic ligament. Anterior to inferior part of anterior surface is related to thyrohyoid membrane and hyoid bone and it is having clinically important pre-epiglottic space. Pre-epiglottic space which is having the fibrous fatty tissue and twigs of the internal laryngeal nerve. The posterior surface is concave transversely, and concavo-convex vertically, and transversely it is concave. The posterior surface is forming the anterior boundary, anterior wall of the upper part of the laryngeal cavity, which is also known as vestibule. This part is forming the anterior-superior wall of the laryngeal cavity, which is also known as the vestibule. This is cricoid cartilage forming the base of the larynx. So this part is the vestibule, so forming the anterior wall of the vestibule or upper part of the larynx. The posterior part is having a tubercle elevation in lower part known as tubercle, and it is pierced by multiple small pits. These holes are in connection to clinically important pre-epiglottic space, and it is having twigs from the internal laryngeal nerve, and it is having openings of the mucous glands which keep the laryngeal cavity moist. This petiolus articulates with the posterior surface of angle of the thyroid cartilage. So this is like an open book. Two thyroid lamines are forming an angle or laryngeal prominence, which is also known as Adam's apple, very prominent in males. it articulates here. Forming the attachment with the thyroid cartilage with the help of a ligament, and that ligament is known as thyroepiglottic ligament single. Thyroepiglottic ligament. So this is the anterior part of the epiglottis and thyroid cartilage, and this is the posterior part of the thyroid cartilage and epiglottis. Two borders, the right border and the left border. These two borders are having upper free part, which is not having any articulation with the ligament or membrane. The posterior surface is covered by mucosa and having epithelium, the ciliated columnar epithelium, because this is related to the respiration, and this is related to the pharynx. So right and left border, upper part is free. Lower part gives attachment. Lower part of right and left border gives attachment to the airy epiglottic fold. Airy epiglottic fold. So in this section, this is the cut part of the epiglottis, the laminae of the thyroid cartilage, and these are the arytenoid cartilages. So the lower part of the right and left border of the epiglottis. This is the right and this is the left border of the epiglottis, and giving attachment to airy epiglottic fold. These folds are having thyroepiglottic and airy epiglotticus muscles. So this was the thyroid cartilage, the epiglottic cartilage. After a short break, I will talk about the thyroid cartilage.